action is taken on prevention. Moreover, statistics and analysis show that 60% of premature deaths, including cancers and cardiovascular mortalities, are mainly the result of bad habits in our modern lifestyle. Our organization was created to lead paradigm shift upstream in the general worldwide medical approach. Therefore, our main objective is to consolidate a cluster of scientific thinkers and private innovation actors to promote the well-being of everyone, notwithstanding the age categories, to develop initiative in education and health prevention, and finally to find main chronic health problem, and of course to reduce medical pressure and cost, public or private, by developing accurate diagnosis and prevention measures upstream instead of only curing diseases. In this summit, we will present you the main core of the World Council, known as the International Share of Cardiometabolic Risk, or ICCR, which regroup international academic specialists from all over the world. Secondly, the Corporate Challenge, a leading Canadian organization in health education and health evaluation through specialized mobile units for accurate diagnosis. And finally, Diamantis, a worldwide leader in mental health, which developed accurate diagnosis and for early prevention in mental diseases. After this brief introduction, it is now my pleasure to introduce you our three main speakers for this forum. First, Mr. Jean-Claude Coubard, my Vice President. He will give you more details about the organization and also will describe the role of ICCR. Mrs. Nathalie Almera, PhD, Assistant Professor and Researcher for the Cardiology and Pneumology Institute at Laval Université in Quebec City, Canada. She is also Head of the Health Program for the Corporate Challenge. In her communication, she will explain the pragmatic solution for health prevention. And finally, Bernard Guimond, Vice President of Diamantis and Chief Corporate Development Officer. He will discuss about the innovative system developed by Diamantis in prevention and diagnostic of mental illnesses. Finally, I would like to remind you all that each of us is an actor in our own health. Therefore, we must propose pragmatic and attractive solutions to attract people and encourage them to get involved in health prevention. It is our responsibility to act and implement. Faced with the urgent health prevention needs, we have created the data organization to provide solutions to health problems worldwide. We cannot wait any longer. Our axis of development is to bring pragmatic solutions in prevention as well as sustainable health. We are particularly pleased with Qatar's position on this subject. Its vision clearly shows willingness to enter in the construction of a future-oriented and prevention-oriented society. One of their achievements is, no doubt, to have scheduled this important World Innovation Summit for Health. As our summit host, every nation has a role to play in building a society based on a pragmatic approach to prevention. That is why our vision and mission is to establish satellite cluster to extend our model around the world and to implement proximity solution focusing on prevention. Thank you very much for your attention. And now Mr. Coubard will follow with his presentation of the organization. Thank you very much.
Thank you, Jean. My name is Jean-Claude Coubard. I'm Vice President of the World Council on Prevention and Sustainable Health. Before introducing our organization, I'd like to warmly thank Sultana Aghdal, as well as Neil Moore and their team, to make this important international forum possible in this very tough period of our time due to the COVID-19. So thank you to their work and to give us the possibility to be here in this important forum. So the World Council on Prevention and Sustainable Health is a global organization. We really want to achieve important goals for sustainable health and prevention for today and for the next generation. So that's why we need a global organization in terms of prevention and sustainable development. Next one. So the World Council on Prevention and Sustainable Health is an independent, non-advocacy organization and non-political organization. We support the development of sustainable health in order to sustain a robust and sustainable economy over time. WCPSH creates a bridge between scientific experts and international economic leaders to drive a global dynamic in sustainable health and prevention in the economic world. In fact, if we have to bear in mind some few words, it's really reaching prevention, active prevention always. So we also contribute to paradigm shift in prevention sustainable health by promoting innovative prevention approaches and creating an environment conducive to changing people's lifestyles. Our main objective, of course, is to switch from disease treatment or management to health promotion, which is a big challenge for worldwide economy and stable development. We speak for a moment, but we don't act. We really have to act for prevention. So we are a platform to consult with relevant organizations, such as economic leaders, ministries, institutions, NGOs, turning scientific evidences. We have very, very strong scientific evidence since years, but we need affordable health programs. So stop talking and let's take action. So as you can see, this slide, we work with 3 very innovative organizations in prevention, which are the International Chair on Cardiometabolic Risk, 2 scientific partners, Diamantis, a worldwide leader in mental health, and Great Corporate Challenge, leader in education and health education with their mobile units. Before organizing this international organization with Jean Barusso, we really wanted to have a validation phase to see if we are in the right way to organize this worldwide organization. We have mobilized top leaders from around the world, politicians, academic leaders, international organizations, ministries of health. They all adhere to our vision and our mission. So we really think that we are on the right track. To illustrate our meetings, we have also met with the Secretary General of the OECD, President Macron, Prime Minister Justin Trudeau, G20, G7, economic leaders and others. We also have presidents and vice presidents of many other countries, as well as the Nobel Peace Prize and other influential leaders. So that's why we are now on board with our partners. And the next part of my presentation will be to introduce you briefly to the ICCR. You may ask why I'm presenting the ICCR, because in my previous slide, I was the executive director of this organization. So the International Chair on Cardiometabolic Risk is an independent international multidisciplinary platform affiliated with Université Laval in Quebec City, Canada. We have 30 scientific experts chosen for their expertise and their outstanding contributions to the scientific community, as well as their status of opinion leaders in their respective discipline. In fact, we gather 5 different disciplines in this organization, which are diabetology, cardiology, hypertension, nutrition, lifestyle, and basic science. We are in fact a forum for stimulation and promotion of research, evaluation and management of patients with abdominal obesity and related comorbidities such as type 2 diabetes, cardiovascular disease, and so on. So we are able to identify and prioritize research projects. We coordinate and analyze epidemiological studies necessary to our education and information programs. Of course, we also try to have collaboration with other international academic organizations, as you well know, the AHA, ADA, ACC, ASD, SC, and so on, for the recognition of abdominal obesity as a major risk factor that should be acknowledged by health professionals. This organization started 15 years ago, and I'd like to show you here the 30 scientific members of this international chair on cardiometabolic. So at the top of the slides of the 5 directors, and as Peter Libby, who is head of cardiology, Harvard Medical School of Public Health, Phil Barter from Australia, Frank Yu, who is the head of nutrition in Harvard Chan School of Public Health, is the top people in nutrition for the American recommendation. And I'd like particularly to thank Professor Jean-Pierre Després, who is the scientific director of this organization, who makes this organization possible. So what we do, we have educational tools for our education and information program, as already told you. We produce scientific and educational material for health professionals and other agencies with peer-reviewed publications. We supplement, we have our e-publications, and we, of course, develop materials and other education programs, conferences, preceptorships, public education initiative, public relations with medical media and the lay public. We have a web portal, myhealthywest.org, and with the experience, we know that we are a source of information for public and private agencies. We also develop our own international congresses to really direct our own messages, which is prevention and always prevention. As you can see, we started this international organization, congresses, in 2010. First one was in Hong Kong, China. Then we went to Buenos Aires, Quebec, and so on, just to show you that we are internationally based. So the last slide of my presentation is the slogan I've patented, which explains all our objectives, which is eat well, drink well, and move. So I'd like to thank you to hear my presentation, and I pass you on the podium, Nathalie, for your presentation. Thank you very much.
Nathalie.
Micro, Nathalie.
Yes. Now I will show this presentation, just to make sure that it will fit out as a mobile medical unit. This unit is made of 6 stations, which are all networked. Participants will enter the unit, and we have an iPad on which all the information will be recorded and already saved on the server on their personal electronic file. Questionnaire about their socio-demographic characteristics, family history, medical history, smoking habits, physical activity habits, nutritional habits will answered. All those questionnaires are validated questionnaire. After this period of rest, they will have their best in blood pressure taken, and then they'll go to the anthropometric measurements station, where we'll have height and weight measures to calculate their BMI, their body mass index, and very important thing, waist circumference will be measured, which is a simple indicator of abdominal obesity, which is the main cause for chronic disease, such as cardiovascular disease, etc. After that, they'll have their blood sampling done, the blood sampling will go to the laboratory. So we'll measure the lipid profile and the HbA1c, and then we'll have to go in the trailer. We have our Move More sessions, which will be the cardiorespiratory evaluation, and they will receive a personalized report. As the assessment process, the results are immediately saved in a dedicated server. This allows medical information collected as previous station be conducted at each station. Let me take you inside the cardiometabolic unit. Here you have a view from the front of the unit. The assessment starts with the computerized questionnaire, as I just said, and it is a resting session before we take the blood, blood pressure. You have at the right the where we take the anthropometric measurements, and at the back we can see the blood sampling and the laboratory. A researcher performs samples. This is immediately treated by the medical technologist. In the laboratory station, we have 5 robots, 3 Piccolo that measure the basic lipid profile, and 2 DCA for the measurements of HbA1c, which provide the information on diabetes or impaired glucose. A total of about 10 minutes is required to obtain the result for a participant. The results are automatically saved in the participant electronic file. During the 10 minutes, which is required for the assessment, the participant will be submitted to a submaximal treadmill test. This test will allow to evaluate response to exercise, heart rate, blood pressure, as well as to obtain the estimated VO2 max. The consultation station allows healthcare professionals to present and explain personalized detailed report immediately after completion of the assessment. Yes, no waiting. The report is already programmed and to be used. This report will provide reference values for age and sex, as well as personalized lifestyle recommendations to choose from to start their lifestyle habits. The whole experience takes approximately 75 minutes, including the explanation of the personalized report. On a typical day, more than 65 employees can be assessed. We have in our database more than 5,000 participants. We have published 2 scientific articles in 2015 in the Medical Science, Sports and Exercise, and in the Annals of Medicine. The science published provides valuable data on the convincing impact of the implementation of the Great Public Challenge 8 workplaces. The results obtained after the 3-month lifestyle modification program are comparable of the well-known diabetes prevention program, which is a 12-month lifestyle intervention program. We have observed a mean weight loss of 2 kilos. More importantly, a decrease of 4 centimeters of waist circumference, a simple clinical marker of abdominal obesity. It is important to underline that it has been demonstrated a decrease of 4 centimeters decreased the risk of developing diabetes of 60%. We also observed a same decrease prevalence of hypertension. An absolute decrease of 0.7% of HbA1c was also observed, in which corresponds to the effect of 1 pill per day to treat diabetes. These important health impacts were obtained due to total improvement in lipid profile, an increase in physical activity levels, an increase in improvement of nutritional quality, and an improvement in the cardiovascular fitness, which should be a vital sign for ideal cardiovascular health. Furthermore, the Great Public Challenge allowed us, the Institute, to create a unique database to further investigate the importance of lifestyle on cardiometabolic and cardiovascular risk. We have also published on the contribution of sample lifestyle risk score in the American Journal of Cardiology. More recently, in 2019, we have published on the contribution of nutritional quality on the cardiometabolic risk profile in the British Journal of Nutrition. And we have documented in the American Journal of Hypertension. the importance of submaximal response to exercise as an early sign of deterioration of the cardiometabolic profile. And that was found also in the normal tensive individuals. In conclusion, the mobile units made it possible to reach a large territory and to educate, mobilize, and give adults, children, and families the opportunity to take charge and take action. It was a pleasure to share with you this innovative initiative and to show that prevention through science, technology, and mobilization can bring to society healthy benefits. Now it is a pleasure to introduce Bernard Rimond from Dimentis, partner in the World Council of Prevention on Sustainable Health.
Thank you very much, Nathalie. Good evening. I would like to thank the opportunity to have Dimentis made a presentation. So, first of all, Dimentis is a spin-off from Laval University that had been founded in 2015. And we are in mental health and developing the first tool that will help the clinician in their diagnosis in mental health: schizophrenia, bipolarity, deep depression, and anxiety. So you'll see the presentation on the screen. So Dimentis offer a first diagnosis tool in mental health care that will allow clinicians to provide more accurate and earlier diagnosis in disease process. Sorry. A faster and more accurate diagnosis will allow better support of the disease and consequently better therapeutic result and reduction in cost. Schizophrenia, bipolarity disorder, and major depression affect almost 9% of North American adult population, which means 25 million people, and that 9% is also the same percentage all over the world. Dimentis use a non-invasive test base on reliable analysis, and that will bring a more accurate information from an ERG assessment biosignal. Dimentis also is the first company to develop a software as a medical device, we call it SAMD, that measure information from a routine eye exam. We call it electroretinography. And we seek to empower physicians and transform mental health diagnosis so its technology improves the standard of care and should be included in the treatment guideline. Like I was saying before, it's a spin-off from Laval University, and the team include experience in life science entrepreneur who raised almost $6 billion in market valuation in previous companies. So now a few statistics that will show you the importance of mental health all over. First of all, 450 million people are affected with mental health through their right now. And with the COVID, we probably could guess that this amount would be even bigger after the effect of the COVID. In United States, 28 million patients have been prescribed for $21 billion of medication in 2015. One of the very important statistics is 80% of all the incoming call of 911 is related to mental health. It shows the importance of having a place where people can be reached and talk about their problem. 45,000 people commit suicide in the US per year, which is more than the car accident. 500,000 people in Canada are away from their work because of mental health per week. And all of that probably because of it's very difficult to be able to diagnose the symptom, because it's the only measure right now, because there's no tool to be able to help the clinician to diagnose the mental health. So the next slide, please. We had Thomas Insel that made a report in, he was the director of the National of Mental Health, and he was mentioning that all over those years, the rate have been decreasing for stroke, AIDS, heart disease, because of improvement of technology. And the only place that nothing did happen is, and was observed for the last 50 years, was in suicide. Suicide, 90% of the suicide are related to mental illness. Reason is quite simple. Different mental disease share the same manifestation. So it can take up to 7 years before you can stabilize a patient, and it can change the diagnosis during the course of that 7 years because the symptoms have changed. So you can see that there's a lot of common space between different pathology, and which make the diagnosis very difficult to come with an exact result. So that's why a tool that will help the clinician will be quite helpful, and that will bring also the earlier diagnosis. And more you can diagnose earlier, you're able to have treatment faster and more exact, so you can bring the person or the patient back to a normal life much faster. So it will improve medication selection and also the promptness of the treatment. So our solution is as an uncomplicated as an electrocardiogram. We are using a non-invasive existing technology, deliver an early differential diagnosis for the most important mental illness that is fast, financially accessible, precise, and also scalable. So the advantage of our technology is, first of all, we have a proof of concept that was made at university and with 1,000 subject, and those patients had a diagnosis, a previous diagnosis for we took patient that has all the illness for more than 5 to 10 years. So we have exactly, we know that the diagnosis was followed, and with our technology we were able to have an accuracy of 92% compared to the normal in reality, which sometimes is 50%, like I was mentioning before. Second is the first SAMD for mental disorder diagnosis and point of care test to reach the market for 2023. Third, a reliable and affordable services offered from one central database. And fourth, impressive systemic efficiency for the physician, the government, employers, and the payer. So how does it work? So the patient will seek the help of a clinician. So he will see the first line physician or the psychiatric that after consultation will refer to ERG hub or having his device in EO's cabinet and run the ERG test to capture the data. The data will be sent to Diamantis Analysis Center, and the SAMD analyzes the data and generate the differential diagnosis, and will be returned to the physician, and the physician will receive and explain the diagnosis to the patient. So of course that will have a huge economic impact, and because identifying the right disorder will positively impact the lives of adolescents and young adults while limiting the weight of mental illness on our economy. Needless to say that, unfortunately, mental illness, 70% will be present between the age of 15 to 25 years old. So this is our workforce. This is the people, the next generation, that are affected with that illness very early in life. So the earlier we can diagnose, you know, the better it is. And compared to other pathology, which come much later in life. So that's why it's so urgent to act and to have tools that will help the clinician as well as the patient to have the right diagnosis. First is it will lift the productivity in business. It will also increase in family revenue. Why? Because there's people that are suffering, husband, wives, or kids that suffer from mental illness. The family have to support, take a lot of time for hospital, for treatment and so on. So there's a lot of burden on the family. Third, reduction on private and public healthcare costs, which also will have an impact on the drop in insurance company fees. And also the fifth, the legal and correctional spend, because unfortunately a lot of consequences of mental illness have judicial impact. So the next slide, please. So the team is composed of people that have been in life science for mainly all their professional life. Mr. Normand Tremblay, which is a CEO, have managed private and also public companies in life science. Dr. Hariton, which is the Chief Scientific Officer, have worked all over the world in different life science companies. And Mr. Lachance, which is the regulatory affair, and myself, and of course other people on the team. So basically what we're looking for at Dimentis is partnership to realize clinical study on schizophrenia, bipolarity, and deep depression, in line with the medical practice and regulatory affair in target countries. And I have to mention that we have 10 sites running right now in North America. We have sites in Montreal, Canada, Toronto, and Edmonton, Alberta in Canada. And we have Rutgers in New Jersey in the States. We have Rochester, and as well as McLean Harvard University in Boston. So, and this perform those clinical study to also make a differential diagnosis. So basically, our technology is a game changer and a unique worldwide as a point of care. So I thank you very much to have listened to what we had to present today for Dimentis, and I will pass the speaker to Mr. Baruso.
Thank you, Werner. I want to thank our speakers, all of them, for their remarkable work. And now, if you have any question, we will be pleased to answer them briefly. Also, in the following list, as you can see on the screen, you will see you will find our team data to reach us after the summit for further discussions. Thank you very much.